So great to have you here, Louise. I'm so happy to have this interview today with you. So shortly, I like to talk to our visitors. So I am the current speaker, the current chair of the Public Relation Committee. So we have had the idea to do this interview with our seniors and special this one who are in contact years ago with Maggie. So I'm very happy to have Louise today with me.
Good morning, everyone.
Good morning, Louise. And I know we know each other since the end of the 80s. So when I come back from Valeo, and I was so happy to have you as a teacher because I know you work directly with Maggie. So this helps a lot. And Louise also was our very first president when we start in 1990, our official IPNFA association. And I would like to say that she was one of really bringing in our clear rules and regulation at the first time. And I also have to say that she is still active in the senior group, and she is as well IPNFA senior instructor and Bobart instructor. So anything to add, Louise?
No, that about covers it.
Yeah.
Except retired, of course.
Yeah, you retired, but we also can say you grounded a clinic, a neurological clinic, right, with your husband together, and a lot of participants around Europe are joining courses in this clinic. So Walzenhausen is very well known, right?
I hope so.
Yeah, I think so. I think so. Yeah, so I like to ask you, when did you meet the very first time with Maggie?
That's real clear for me because I was a student at St. Louis University, St. Louis, Missouri. And the head of the PT school was a good friend of Maggie Knott and invited Maggie for a weekend course or seminar, and the students were allowed to go. And so, of course, I went. And I thought, oh my goodness, this is really interesting. Yeah. And it turned out that I asked the head of the school if it would be possible to do my last affiliation in Vallejo. And that was a little bit of a question because Vallejo only took, I think, like 2 students or so from Southern California to be able to attend the course. And I was just lucky, and I got to go on my last affiliation. And instead of staying 3 months, I stayed 4. Maggie let me stay an extra month. So that's how I met Maggie.
Great. So we have to add that you are originally from United States.
That's right.
Why you have your study in United States, but you went to Switzerland very young, right?
Yeah, actually, in Vallejo, and that's a whole nother story. In my class, I was so lucky to meet people from all over the world, actually, and from Europe, of course. And one of the course participants with me was Wiltrud Schmidt, who was the head of the PT department in Bad Ragaz. And she asked me and Arya Paca, at that time, Arya Ferencik, if we would be interested in coming to Bad Ragaz to work for 1 season. A season was 9 months. They were only open for a season. That was the thing. I thought, oh gosh, yeah, I'll do that.
Yeah.
That's a good decision. That was a good decision.
Yes. So maybe for the young colleagues, they listen us or our members, we can add that Bad Ragaz was Hermitage, a great center. And there were a lot of courses and a lot of great people around the world. Also Bobart and Maitland and Klein.
Almost everyone came there.
Everyone come there. And we can also say that they really work together quite great.
Well, it was one of the, I think, the first really continuing education center in Europe that worked full time like that and invited everybody who was important in the therapy. And that was thanks to Dr. Zinn, because he wanted his therapists to be well educated. And so he made sure the best people were able to come to Bad Ragaz. And I mean, almost everybody in those really early days, almost many therapists from Europe came there for some continuing education.
That was really great.
Yeah, so, it was important. Yeah.
Yes, and when did you decide to go ahead with the PNF concept? Because I think Bad Ragaz, you did also different courses, right?
Oh yeah, they gave a lot of courses. That's true. But I thought, I mean, PNF is my first love. And in Vallejo, I thought this fits to me. This whole concept fits. How I think about people. It had a lot. I mean, I learned about interdisciplinary work in Vallejo because they had the nurses and the OTs. Everything. It wasn't so connected all the time, but still, it was pretty impressive. And the positive approach, I thought, yes, now that's something that should always be there. And so there were a lot of different things that I saw that I thought, and I liked the physical. I liked learning how to feel the patient's muscles and their tone and what they were doing, and learn how to try to get that into my own body, that I could feel what they were doing and what they were missing. And I thought, this is good. This is really good. And therefore, it fit to me.
And now comes in my mind, when you're talking about positive approach, that you were also, I think, the very first one. And at that time, we didn't have this really fixed in our schedules. I remember in London that you brought in the first time motor learning concept, right?
It was motor control, actually.
Motor control, right.
Because I went to I was quite USA oriented, actually, in a lot of my my own coursework that I was taking. And I went to the two-step conference in, where was that now? Was that Oklahoma? I don't remember. Anyway, and that was something that just where a light bulb went off in my brain, because it brought together a lot of things that I had experienced in therapy, but I didn't understand how that worked. And I mean, the role of the activity, you know, and it put together the muscular and tactile, and it put together everything. I was going, oh my goodness, now this is interesting, you know. And so I started spreading that around everywhere, I must say. And the PNFers got a lot of that from me, I know.
Yes, I really remember that we have the feeling the first few years that you are really the master of motor control. And and I think we have many years we have had the connection and your ideas, and needs longer time to implement really all of our instructors, but now it's fixed in our...
It's fixed in science, in neuroscience. And it makes sense. And that's what it was like, oh yeah, that makes sense, because you see this in your work. And if you use certain principles of that, you really notice the difference. And it's like, oh, that's something really good. So it's not a treatment concept, motor control. It's trying to help your way with your patients when you're doing your clinical reasoning, you know, now what does this mean and what should I do, and so forth and so on.
So would you say that the impact of Vallejo really have a big influence in your whole profession life?
Oh, there's no question about that. There's no question about that. I mean, that gave me the foot up, actually, in my professional life, and gave me the drive too, to try to learn more. I mean, you know, I was so lucky, and I'm serious. I was so lucky to work in Bad Ragaz and in Valens later, and to be connected with the Hermitage. because there was so much input there. I mean, I was so lucky that I was in Vallejo and that I moved over to Madrigas. That's no question about that.
Yeah. And then you stayed in Switzerland, and or did you go back to States?
No. When I came over, I stayed. I stayed. When I moved, I was a therapist in Bad Ragaz in the Medizinische Zentrum, in the medical center.
Yes.
And then they asked me if I would take over the head position of PT in the rehab clinic in Valence.
Yes.
Bad Ragaz is an outpatient clinic, and Valence was, of course, an inpatient rehab.
Yes. And can you tell us a little bit more then how often Maggie was coming and how was your working together?
She actually, it was funny when I got to Bad Ragaz. I lived in the Hermitage. That's where we lived. Where the study center wasn't.
I know the room.
Anyway,
yes.
And then all of a sudden, one day, a couple of days later, in walked Arya Ferencik. She was I didn't really even know she was coming over. That was pretty funny.
I was thinking about how was the way going when Maggie go to Valo.
Oh yeah, with Maggie.
And then
and then that was that. I was thinking of how Arya got there too. And then the study center had started, and Maggie came probably not even a year after we had started.
Yes.
So, and she came another time too.
Yes.
And then so I got to work with her at least twice in Vallejo, and after that in Bad Ragaz. And after that, I don't think she came back anymore.
Yes.
Well, I was there. I would know that, but no.
Yes,
but at least twice. So that was really good.
Yes. And then they did at that time also these nice videos when she treat Aya, and we also share the videos later on in our history. Yeah, we still have it. That's great. And how about the instructor time? So Maggie or Sue was involved already, have the idea to educate you as instructors?
Yeah, that's true. And I got, we were all involved in that and it was mostly Sue. But Maggie was always informed what we were doing and gave her okay, but she wasn't interested in getting involved in that really. But Sue, and of course Sue had been in Vallejo a long time. And so Sue, now what I just, was interesting. I was looking at it, and this is her letter to me that I'm a PNF instructor.
Oh, wow.
And that was 1981.
Wow.
I had been giving courses already, but this was the start of trying to get everything standardized and trying to get instructors together, because there were other courses going on, like in Germany and in different places, but there wasn't any standardization yet. So, so that was this instructor course to try to get things more official, because we didn't have the IPNFA yet.
Right.
That's right.
Yes.
But it was Sue Adler, and she was what did they call her? She was I gotta look at this again. She was in charge actually of instructor training.
Yes.
Even before the IPNFA started, but with the IPNFA also.
So we can say you and Arya and Inge also was one of the first instructors?
Absolutely.
Yes.
Yeah.
And then you organized together with Sue the next group education for instructor, right?
Oh yeah, well, Sue was she was the one who was the basic one to, what belongs in a basic course and so forth and so on, trying to get it structured, because that was happening before the IPNFA.
Yes.
So, and she was the main driving force there in this sort of education committee.
Yes.
before the education committee.
Yes.
So, but she was a driving force there.
Yeah.
And of course, she and Mott and Dominic wrote those books together. You know, it
Yes, yes.
fits. It all
Yeah,
fits.
that's great. So
Yep.
as my memory and as I have information, it was around 84, 85 that the first time you have really come together and talk about founding, grounding instructor group, right? Around middle of the
Yeah,
80s.
about then. Yeah.
Yes, yes.
You know, we had always talked about it because I think the other groups like the Bobeth people were also doing the thing at the same time. Maitland too.
Ah,
They were trying to
yes,
get everybody was trying to get organized at that
yes,
time.
yes,
Today, you know, with IMTA and all these other things,
yes,
it's clear. But at that time in the 70s, 80s, it wasn't that yet. And so
yes,
that's
yes,
what we were doing.
yeah.
Mhm.
This is so great. So, and when we talked private to each other, we have had a feeling that we need much more stories about Maggie. But I would like to ask you, what do you remember? What comes first absolutely in your mind when you are thinking about Maggie and your time?
She was kind of scary, you know.
Yeah.
I mean, I remember when we were working in the gym, you know, we got with these yellow things
Yeah.
that was put in our mailbox and told us which patients we were going to have and what we were supposed to do
Yes.
at what time and how long.
Yeah.
She didn't tell us that any other way. That's what happened.
Yeah.
The famous yellow notes. And you were kind of scared when you got a yellow note anyway.
Right.
But and then you're in the gym, you're working, and I really saw. And Maggie would come in, and she would come in, she would stand there like this.
Oh.
And we're going, oh God. And I even saw some therapists kind of hiding behind their patients, you know. But she wanted to know what's going on in her gym with her patients.
Great.
And she'd come and tell you, you know, you have to do more of that and more stance phase, and the pelvis is not in, and you know, that kind of stuff.
Great.
And so she was impressive, yeah. But I mean, that's why we were there to learn from her. So
Yeah,
that's good.
absolutely. And when we look, she was coming from the military. I think the voice
Oh, well, yeah.
and the commands are a little bit more
Yeah,
rough.
she's tough.
But
Yeah.
I also have the chance to assist few times Arya. You mentioned Arya. I know her as Ferienchick. Unfortunately, she passed away many years ago.
She
So
was a good friend, a great colleague. We did quite a
yes,
few courses
yes.
together. Yeah, it was great. I really miss her too. Yeah.
Absolutely. And I would like to say that she gave me all the time the impression, and she was saying, even it looks rough, what she was doing on my body, it was um, really soft hands.
I remember one time we were in the class and Maggie was teaching the class, and the class was head and neck for trunk.
Mm-hmm.
And if anybody knows that, you start with an overhanging
Yes.
situation with the head, and then you come in the pattern and you go to the trunk. So
Yes.
you're using the strength of the head and neck for the trunk.
Yes.
And I just was going, nah. You know, and no matter how it just felt awful. I thought, holy mackerel, you're pulling your neck apart. And I said to Megan, I don't get this. Can you do this on me? I want to feel it. I just can't imagine. She said, sure. I thought, okay. And seriously, it was like when she did it, I was going, oh, that's what you're supposed to mean. Because you're not
Okay.
hanging on the neck.
No.
But it was it was really fine and soft and got right into my trunk, boy, I'll tell you. And the head pattern was in.
Yeah.
And it just locked in and went wham right into the trunk. And that was one time where you think, oh God, be careful with the head and neck. Well, of course.
Yes.
But if that's the strength, boy,
Yes.
and you have good hands,
Yes.
and
Yes.
it's perfect.
Yeah.
Perfect.
Yeah. This
But
is.
that takes practice. And that I wrote down in my preparation here. I think what I learned in Vallejo is the importance, if you're doing hands-on therapy,
Yeah.
you have got to be able to feel it. It goes into your own body and you feel it.
Yes.
You feel the different rotational components. You feel all the components. You feel what's strong and what's not so strong. And it's not just giving the resistance. You feel it
Yes.
during the resistance.
Yes.
But you've got to learn that. You've got to feel it. What do I emphasize and what don't I emphasize? And geez, it takes a long time to feel it.
Yes,
But
absolutely.
after you've got it, man, that whatever technique you use, whatever concept you use, if you've got that good hands and it goes into your body, you got it.
Great. Yes.
You can't do stretch reflex
Yes.
without that. That doesn't.
Right. And this is
That's something for every therapist, no matter what. You've got to work on yourself, on your own skills
Yes.
to be able to do whatever, you know.
Yes. I'm so happy because I didn't touch and meet Maggie, but when you have had teachers like you, or I was thinking about Hink, Marie-Louise
Yes,
Mangold.
absolutely.
Unfortunately,
She was the first vice president of the
yes, she
IPNFA.
also passed away, so unfortunately. But she was one of my teacher in Vallejo time, and she really moved her body with my body all the time. And then you get the feeling what you are talking about now. Get it in your body. So this was her.
It goes to you. It's good self-training. You can't even imagine. It's not, you know, I think everybody's complaining about patterns and so I don't. Because you use those to learn something and you feel something and you do these patterns. I did patterns on every patient I did just to feel it, where they're at. What do they have?
Right.
Did I stick with patterns all the time? Of course not.
No.
But it was something very, very good. I thought, well, with some of my polio patients, I did a lot of patterns.
Of course.
Of course. Yeah, right. Yeah.
Yeah. But we all know that PNF is much more like pattern. It's only one of our basic principles. And for this, I really like that we also have implement now the whole series stuff you bring in a lot of times. So great. I think slowly come to the end for the first time. What do you will give? I talked already about the young colleagues. Now I would like to talk about the young instructors, because a lot of our young instructors never have had a chance to touch you. So what would you say? What would you give them as advice for their future being IPNFA instructor?
I think you have to learn a lot and you have to do your own continuing education generally. You have to know what's going on out there and not just say, well, you know, learn more. And then I think you have to practice a lot yourself and be really self-critical when you're treating patients.
Yes.
Yeah.
Yes.
And I think you have to, when you're working with students, you have to make sure that you do whatever you're doing on the participant, that they can feel it, you know, and that you can feel how they're moving. Because some people have a lot of trouble with their own body, which reflects in their ability to do, you know, PNF or anything. So I think that's something you have to really work on yourself and realizing that it's a long process, but you know that yourself. But sometimes in teaching, you expect it faster from the participant, and you have to get them where they're at. You can't, you know, and you have to, there are different levels, and that's always difficult when you're teaching, you know, because especially with hands-on things.
Yes.
Because not everybody is at the same level. So it makes it interesting, you know, but and a lot, and always work with patients, because what you do on each other is one thing. But seeing how they're using it, because that's the point. They're supposed to be able to take it home and work with their patients with this constructively. And so make sure there's always patients there, you know.
Yeah.
So you can help them through not only the clinical reasoning, but the actual hands-on treatment.
Yes.
Yeah.
So
I was just thinking something interesting
yes.
about Maggie and Valeo and stuff. You know what Maggie always used to say when she'd come in the gym or in the treatment room? She'd say, "Trunk, trunk, trunk." I mean,
Yeah,
and like
right,
that.
right.
And it's so interesting because that's what we say today too, you know. So you're
Absolutely.
right on cue if you're in the PNF
Yes,
program.
posture control, so important coming from the normal motor development. This is also what I'm saying all the time. That's so great. So we took over, even if we are not really direct listener, but you transfer, and the other senior
Yeah.
instructors also what they learned from her. So
There, you know,
great.
there are new things coming in, but don't throw away the old. Keep
No,
everything in your backpack, you know,
no,
because
no, no.
these skills and these tools, you're going to need them sometime. There'll be some patient that makes you reach into your backpack and think, now, what am I going to do? How
Right.
am I going to do this? So that's good.
Right. Yeah, there's a nice sentence. I like it. I have it quite often in my lectures. That's arrogant if you throw away the old stuff, right?
Yeah.
If it's good, if it's still working. So
Yeah.
this is very important that we keep it. And for me, this is the reason why I am doing this. For me, so important to keep the spirit, because now we have a lot of young instructors never have been in Valeo. That's okay. They can be very
Oh, of
good
course. Yeah.
instructors, of course, yeah. And
That's why we're here. We're trying to give it to them, doing our
right,
best.
right. And I really have the information that they are really they sucking in if you're talking about the old times. And I'm saying all the time, I'm sorry, I'm can say I'm between. I'm not really in this time together with Maggie, but this
Yeah,
is
that's
yeah,
okay. You
so
know, I
important.
think there is already a bit of a problem with the hands-on versus the robotics and all
Right.
of that. And it's not either or. You need
Yeah,
both.
both, right?
So, and I think we have to keep that in mind.
Yes,
Don't
yes, yes,
don't
yes.
forget it. Yeah,
Yeah.
because a robot doesn't have the tactile kinesthetic information. It also doesn't have this total auditory information and all of that we give them at the same time. And so, you know, it's a good thing. It's really a
Yeah,
good thing.
it's great. It's great.
Okay.
Yeah. So, Louise, thank you very, very much for your time. I'm
I
so
thank you for inviting me.
that you are still with us. And yeah, really, I'm so happy all the time that you still give your ideas and help us as long you can. And I think will be great because I got just now the information that you're coming to the next meeting in Osaka.
That's right.
So that's also so great that young instructors have the chance to talk with you. And I think maybe this is part one, and we will find other ideas to talk about and have a next interview. So thank you very much.
You're very welcome. Thank you again for the invitation.